Welcome back, it's Dr. Somji.
And it's Dr. Solomon here.
Today we're going to be talking about how long hair transplants last. It depends where and who you get the hair from.
Yeah.
We split the hair in hair transplants into what we call a donor area, so that your supply, and a recipient area where you're balding, basically. The donor area traditionally, for both females and males, is this side area, so back and side area. We call this the occipital region, and this is the temporal area.
So that's where we take the hair from.
Exactly. For a man, for instance, that is hair that if you see someone that's completely bald, they will always retain the hair around the back and sides, but in a thin, almost like strip area within this area. And we call that the safe donor area because we know that if we take hair from this area, then it's got good longevity. So you will see people go to the grave with hair around that area. So technically, if you take it from that area, you will have last of more than like 20, 30 years, even some permanent to the grave. Now, this is where it gets a little bit more tricky, right? Because let's explain the difference about strip surgery getting directly from the donor area and FUE when you're on the boundary.
Okay, so with strip surgery, you're essentially taking a strip of skin, cutting that out from the donor area, which we consider to be the safe zone. Safe in terms of the hair survival, because we know it's a genetically different hair. It has a different genetic code, and therefore it has that longevity, it has that survival bias to it, survival benefit, I should say. And when you do a FUE surgery, so when you do follicular unit extraction, you're taking individual hairs in perhaps inexperienced hands, or perhaps in hands where maybe there's not enough care put into where the extraction is taken. You can actually take hairs from an area which is genetically prone to hair loss.
Yeah.
And therefore, you will lose that hair just as you're losing your current hair.
So like if we see on the camera, as we get older, the hairline moves up here to a very small area like this, if we're talking about way into like 70s and 80s, and the same around the back and sides, and obviously this comes down, so all this area contracts, and that is where sometimes with follicular unit excision, FUE, you breach that area. Now there's advantages and disadvantages of that, because in younger patients, sometimes I go in those areas and I put those hairs at the front. So as you age, you naturally lose. And that's not a bad technique sometimes, and that's some of the advances in hair restoration. But if you want longer lasting surgery, then it's really important that your surgeon stays within what we call the safe donor area. And you should get decades in terms of your hair transplant.
Yeah.
Now, obviously, there are other scalp conditions that can mean that you can lose your hair, such as kind of certain types of alopecia areata, alopecia totalis, as well as inflammatory conditions.
Infectious conditions as well.
Infectious conditions can also damage the hair as well. But if you stick to that safe donor area, no matter which method of hair transplant surgery that you use, and there are other videos in our hair series talking about these in a little bit more depth, as long as your surgeon sticks to that area, then you should have really long-lasting results. Thank you so much. If you want to know anything more about hair transplants, or anything a little bit more in particular about what we just talked about, don't forget to subscribe, but also comment below. Thank you so much.